Step-up therapy in Black children and adults with poorly controlled asthma. Definition: morbidity from asthma is disproportionately higher among Black patients than among white patients, and Black patients constitute the minority of participants in trials informing treatment. Data indicate that patients with inadequately controlled asthma benefit more from addition of a long-acting beta agonist than from increased glucocorticoids. However, this data may not be informative for treatment in Black patients.
There are three things that are very important. Always have your medicines on hand. Know how to use your medicines to control your asthma symptoms. Know how and when to get help when you need it. Working with you as a team, we at Children's Hospital of Pittsburgh and Children's Community Pediatrics can help you keep your asthma under control. Here's more information about what asthma looks and feels like from asthma specialist Alvin Singh.
If you're going to try to control your asthma, it's very important that you know what asthma is and what it looks and feels like. So let's talk about what happens when you breathe. You breathe air in through your mouth or nose, it goes down your windpipe or trachea, and then to your lungs through various sized airways. In asthma, a trigger of some sort causes the airways to become inflamed, swollen, and filled with mucus. This causes obstruction of the airways, which makes it harder to get air in and out of the lungs. Your chest might feel very tight, as if someone is sitting on it. You may cough a lot and also have trouble keeping up with your friends during sports or other activities. You may also notice a whistling sound when you breathe, which is also called a wheeze. These symptoms can occur during the day or at night. Some people who have an asthma attack say it's like trying to breathe through a straw. Other symptoms include rapid breathing, breathing with the shoulders, and flaring of the nostrils. Smaller children can have rapid breathing as well, which can sometimes cause the skin around the neck and the ribs to be sucked in. Any child can have the symptoms described above with a cold, but if the same symptoms keep coming back more frequently, you should think of asthma as a possible diagnosis and see your pediatrician. Asthma can be brought on and made worse by different things. Allergies, which are accompanied by sneezing and runny nose, can also make asthma worse. Seasonal allergies can also make asthma worse depending on the time of year. Various allergens, such as dust, grass, ragweed, and mold, can make asthma worse. Other triggers, such as changes in weather, crying or laughing very hard, and the common cold, can make asthma worse as well.
Hi, I'm Linda Earhart with the American Lung Association, Program Manager for Pennsylvania Asthma Partnership. I hope you found these videos helpful. For more information on how to stay healthy and gain control of your asthma, you can visit these websites, chp.edu or paasthma.org.
Applications in medicine methods. A study has conducted two prospective randomized double-blind trials, one involving children and the other involving adolescents and adults. In both trials, the patients had at least one grandparent who identified as Black and had asthma that was inadequately controlled with low-dose inhaled glucocorticoids. They compared combinations of therapy which included the addition of a ABA salmeterol to an inhaled glucocorticoid fluticasone propionate, a step up to double to quintuple the dose of fluticasone or both. The treatments were compared with the use of a composite measure that evaluated asthma exacerbations, asthma control days, and lung function. Data were stratified according to genotypic African ancestry.
I know his asthma isn't a problem. What do you mean?
Many children with asthma never have wheezing, at least that you can hear yourself without a stethoscope. Symptoms from asthma occur when the muscles surrounding the breathing tubes squeeze and tighten, which makes it very difficult to get air inside the lungs and body. For many children, their only symptom may be coughing. Other common symptoms include shortness of breath, difficulty breathing, chest tightness, and wheezing. Every child with asthma is unique and has their own symptoms which may differ from other children with asthma. In addition, each child may have different symptoms depending upon the day and what triggered their asthma symptoms at that time. A late sign of asthma is when your child uses their rib muscles or neck muscles to help them breathe, or they become very short of breath. If you see this means that they are working very hard to breathe, and they need to be treated with the rescue medicine immediately. You may also have to take them to the emergency room, as they can become very tired if they breathe like this for too long.
Wow, I didn't know all that. Thanks. I'll really make sure I pay attention the next time my child coughs.
Pros and cons. When quintupling the dose of fluticasone was compared with adding salmeterol and doubling the fluticasone, a superior response occurred in 46 of the children with quintupling the fluticasone in a 46% of the children with doubling the fluticasone and adding salmeterol. In contrast, more adolescents and adults had a superior response to added salmeterol than an increase in fluticasone. Neither the degree of African ancestry nor baseline biomarkers predicted a superior response to specific treatments. The increased dose of inhaled glucocorticoids was associated with a decrease in the ratio of urinary cortisol to creatinine in children younger than 8 years of age.
My name is Dominique Kim, and asthma runs through my family. My sister has it, my mother has it. I've lost a best friend to it, and now my daughter has it, and I'm scared I might lose her one day.
I'm Jake Cohn, and I've had severe asthma since birth. My lungs are extremely scarred from asthma and from all the steroids, and my whole childhood just severe coughing spasms and asthma attacks have damaged my lungs.
Jake's been a big challenge. For Jake, we've had to use everything that we've learned from clinical trials to bring innovative new treatments, medications, procedures, lifestyle changes. What is the next thing we're going to offer him?
I am scared, I've been scared since she was 3 months. I could tell she was having trouble breathing, and she started turning pink, and I got somebody to bring me to National Jewish, and luckily we made it here just in time. It's just a really scary feeling with a 15-month-old. I'm scared to wake up to my child not waking up in the morning. She's only a baby.
Boy, Kayla's really young to have such a severe case of asthma. She's already been in and out of the hospital. She's had several life-threatening episodes. There could be speed bumps along the way. And what I'm really concerned about is the next speed bump could cost her life. When are we going to get to a cure for asthma? And people like Kayla and Jake have more options.
Issue applied in Ecuador. Although epidemiologic studies involving Ecuadorian and US patients with asthma show a greater burden in Black patients than in whites, treatment recommendations are based on trials with few Black participants. Furthermore, response to asthma pharmacotherapy can be affected by genetic variants that reflect diverse ancestries.
Until a trip to China, 58-year-old Scott enjoyed running and playing sports without any problems. But 10 years ago, on that trip, he started wheezing and enjoyed running and playing sports without any problems. But 10 years ago, on that trip, he started wheezing and was diagnosed with adult onset asthma.
And I remember friends of mine when I was a kid who had asthma, thinking about what that would be like and glad I didn't have it. And so for me, to have it and to get it at that late stage really was a shock.
Now Scott controls his asthma with an inhaler, regular medication, and trips to see his doctor.
The fact is that we don't know why some people have it as adults. We don't know what factors of the environment that interact with this genetic predisposition.
Researchers suspect vulnerable genes triggered later in life by air pollution, viral infections, tobacco smoke, fumes, or allergies are what bring on asthma. But here's some good news. We now have advanced medications that prevent or suppress asthmatic attacks altogether.
It is one of the most exciting times in my professional career as we are poised on the crest of the wave to understand why someone develops asthma.
With his asthma controlled, Scott is back on track, running with a great outlook on life.
You gotta say, I'm gonna go do this. It's not gonna stop me. It's not gonna debilitate me.
Patients like Scott can also prevent asthma attacks by avoiding certain products in our daily environment. People with asthma need to know that certain chemicals like perfume or cleaning products can affect you. Irritants in those chemicals can trigger an asthma episode.
To avoid that, just
Conclusion: in contrast to Black adolescents and adults, almost half the Black children with poorly controlled asthma had a superior response to an increase in the dose of an inhaled glucocorticoid, and almost half had a superior response to the addition of a LABA. Thank you.